All right, welcome back. My name is Javaid Siddiqi. I'm the president and CEO of the Hunt Institute. I want to thank the Ronald Reagan Institute and Roger, Janet, our friends for having us in this partnership. Our conversation this 30-minute window is going to be focused on our youngest learners, early childhood education. This pandemic obviously has been a major disruption, but candidly, the system was in despair before the pandemic. The pandemic has only invited other people, mainstream folks, to the conversation. We knew we don't pay our early childhood workforce enough. We don't have enough early childhood centers. So this pandemic has been a good thing in some regards, and I'm hopeful that these two experts will sort of elaborate on what are the takeaways from this crisis that we've experienced these past 18 months. But the conversation really is going to be focused on the decline on pre-K and kindergarten enrollment. It's been a record, expected a record registration enrollment numbers coming this fall because so many families decided to take their kids out of public education last year. You're familiar with the redshirting concept where we're going to take our 5-year-old, let them have another year so they can be the best kindergarten student possible. The reality is we didn't trust virtual education, many families. We didn't know what hybrid was going to look like. We didn't know we could trust the safety of our kids. Are our kids going to be safe? There's still no vaccine coming to a neighborhood near us as we know it. And so we have teachers that are going to come back into the workforce this 3 weeks now, less T-minus 3 weeks, and they're going to have young people that are not vaccinated. Will they be wearing masks? Will they not be wearing masks? The biggest things that I'm thinking about is they've been isolated for 18 months. The social emotional learning, the strategies, the coping strategies, how to engage with other young people. Teachers are going to have to deal with that, along with the academic deficits we know they're going to be coming to kindergarten and pre-K with. So I'm thankful to have this great panel joining us. My friend Ellen Galinsky is the Chief Science Officer at the Bezos Family Foundation. We appreciate you being with us. And one of our Hunt Kane Leadership Fellows, the Lieutenant Governor from Delaware, Bethany Hall Long. Thank you, Governor, for being with us. Governor, I'm actually going to start with you. Can you talk a little bit about, from the Delaware perspective, what have you seen happening in your state in regards to early childhood from providers, from families? What have you seen to be what's most in need right now in Delaware?
Well, I think all of us, as we heard earlier from other electeds, not only have been the fiscal concerns, making sure you have the resources, having in place, whether it be addressing initially the pandemic with COVID testing, making sure we have available faculty vaccines, but really up in front, personal to me as a professor of nursing in my other hat, as well as Lieutenant Governor, has really been, and we're going to talk more about this, is also the physical needs, but the emotional, social needs, and ensuring in Delaware, we created some unique programs, can talk to you later about, that not only provide for additional fiscal resources for services for children, but taking it to the doorsteps, being at the home where people need service. I think we just heard our former Secretary, Arnie Duncan, talk about that. And that has been really critical for our littlest ones. And hopefully we'll have a chance in a bit to talk about some of those ACEs and trauma and how we can work to address that. So both the physical resources that we've addressed, making sure daycare facilities, early learning have their doors open, which employers have all wanted, as well as making sure those emotional supports are in place. So that's a quick answer. Hopefully can give you some more detail in a moment.
Well, thank you, Governor. Ellen, let me come to you. We're working right now in partnership with you on a documentary to sort of highlight what this experience has meant. This project is going to talk about the impact, how this pandemic has affected young people and providers. What are some key takeaways? I'm disappointed we couldn't have the video quite yet, but I know you have a few maybe key takeaways you could share with us.
I do. Thank you. Thank you so much. The University of Oregon jumped in very early in the pandemic and began to collect data on a very regular basis, every 2 weeks, and then a little bit longer of families. And I think it's important, as you did, to talk about birth, not early childhood, just as pre-K, but birth. And I take it up to 8-year-olds, so birth through 8. And they found at first that 20% of families were suffering economic hardship, really having trouble surviving financially. It went up to 40% in last July, about a year ago, when the first CARES money ran out. And then it stayed at about 40% throughout. But if you look at families of color or low-income families, it was closer to 60% of families. So that's a real majority. On the other hand, Harvard has done a study of a representative group of both families and the kind of systems that children are in. Sorry. And what they found was that there was a lot of resilience among families. So what I want to do, Javaid, is flip the switch now and talk about what the lessons are. In the spirit of a crisis is an awful thing to waste. What have we learned? And I think of the things we've learned as being there hidden in plain sight, but it took a pandemic for us to be able to see what's important, at least from a developmental perspective. And the first thing is you can't really separate out care and education. Children got food at schools. It was a safe place to go for families. And so the notion that for families who work, the notion that there's school and then there's childcare is really is historically accurate, but actually developmentally false. And so we need to think about that whole child. What we saw during the pandemic, and this is true in the Massachusetts study, was that teachers brought food to families, that schools became places where families could get diapers. The people really relied on the social support of the early childhood system, which, because of its lack of federal funding, was in real jeopardy. But the ones who survived stayed open and continued to provide, drove things over to families, just really were the new extended family that made the system work. The second thing that I think we learned is that you can't separate children from their families. We always say teachers are parents are the first teachers, blah, 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 blah. But it doesn't really work that way in practice. We've heard in the documentary that Dan Murray and I are working on, we heard people say that we always say we should be talking to families all the time, but it takes something going wrong to really call in families. Well, we can just keep that picture of the Zoom call with people at work with children there in our minds forever, because children are really not learning without their families. And so I think the best programs found a way to engage families, not just children, whether it was virtually or in person. Not just having the families have kids do homework, but Tools of the Mind, for example, we interviewed Deb Leong there, and she talked about how families, they engage families in fun activities with their children, and then did videos of them together and could coach them about, well, do more of this because it's really engaging your child. So again, we have to think of the whole family, not just the child, the whole child. And then communities. Secretary Duncan talked about those missing children. Well, we heard from Kwesi Rollins in this documentary that we're making, that the communities at the Institute for Educational Leadership, that the communities that were connected beforehand didn't have those missing children. They knew where they were. They knew how to find them. It didn't take 17 calls to figure out where those children were, and they could get them involved right away. So again, in flipping the switch, we need to think in the future, in the spirit of a crisis thing. The crisis is an awful thing to last. We need to think about having connected communities, because education isn't just separate. We have to think of the whole child, the whole family, and the whole community.
Thank you, Ellen. Governor, I'm a former middle school principal, and I've unfortunately had to deal with a lot of tragic events with young people, loss of parents, loss of siblings, house fires. This is something we could never in our wildest dreams have imagined. How should schools, what should they be thinking about doing differently, especially the schools that have, their kids that have been 100% virtual for 15, I guess 18 months now. We learned a lot from March 20 to August of 20. Schools look dramatically different. I think public education took a lot of feedback and responded better. It was markedly different. How much different will it be August of 21, and how much different should it be?
And this is a great question. As chair of the National Lieutenant Governor Association, the Reagan Institute, and like the Hunt Institute, we know there's diversification across our country and our territories on how we approach these issues. But what brings us together, as Ellen so gratefully indicated, it's our responsiveness in working in the community. And again, our panel today is emphasizing a little bit on early childhood birth forward. So I could tell a whole different story on high school and middle school, but the common denominator I think is really important. In Delaware being, small, certainly we were able to do those strategies Ellen mentioned, where we not only took the fiscal dollars to ensure that we kept open every child care center that we possibly could in the state, that we invested in teachers and the workforce, but taking it to the next level, as I indicated, and you mentioned the social emotional component that we all have the opportunity to pull in from our federal dollars down into the state, ensuring children are recognized that they're coming, particularly with ACEs and trauma. And we have other experts in here. And I know Ellen has written on that with our brain response, brain health. A couple quick examples. Myself, and I know several other electeds, we go out on the street. I go out and I've been out in full PPE, kind of like the undercover lieutenant governor. And when I go to the door of these rooms, I shared this last night with David Dahl, who sat next to me, and my partners at the Reagan Institute, where we talked about how we serve our communities. I think schools are going to have to be flexible. We're going to have to be patient. We're going to have to really think about the social emotional learning, and we're going to have to look at how we're serving. And we had this long conversation last night about, is it underserved or is it misserved? And making sure we put those dollars to those trauma experiences. And when I went to the door, last thing I'll say, when I go door to door to the hotels, half of the hotels, even in our fine small state, and I guarantee you for the policymakers here and elected advocates, you will find probably half of those low income children are in your hotels who are being serviced, whose parents have lost their jobs, who are struggling with the opioid epidemic, who are really challenged. And so if the parent is not able to get themselves together, the trickle down, and particularly at middle school to early learning, is imperative. So we had to make sure we had those iPads. We had to make sure we had in-home services. We have to have the wraparound care so those children don't fall through the cracks. And as Ellen indicated, some states, I think, have done a better job. And thanks to the Reagan Institute and others, I think, our conversations today, we can share best practices.
Yeah, thank you for reminding us. We're not just dealing with the pandemic. We're dealing with problems before the pandemic that were major problems, opioid crisis being one of them, access to food, homelessness. So the pandemic is only pronounced so many other bigger issues that we're going to have to reconcile. It's coming to a neighborhood near us. Ellen, so let's talk about learning loss. We've been hearing learning loss, all for the past 15 months. Is that the right way to be thinking about it? And if not, how would you potentially recast our thinking?
The governor talked about some of the trauma and the difficulties that have happened to families, and that clearly can be seen as a loss. I think we have to understand that has been, that the pandemic, people have lost family members, people have lost jobs, people have lost income. There are many, many losses that people have had, and those are real, and we need to listen to those and honor those. But again, in the spirit of flipping the switch, I think of what Valora Washington from the Kale Foundation Institute said to Dan Worry and me when we interviewed her, which is, we can't just say this is a lost generation. We can't just say this is a terrible, awful thing. I don't know how many of you know about the notion of growth mindset, where a fixed mindset is nothing will change. Carol Dweck's work in the research. A growth mindset is that things can change. And I loved what Valora said, which is we need to have a growth mindset about the pandemic. I would take it actually one step further. In the research that we're doing at the Bezos Family Foundation, we're looking at what we call an adversity mindset versus an opportunity mindset. And an opportunity mindset means that both we think that change is possible and that we can make it happen, each of us as an individual. So I would hope that we have an opportunity mindset about the pandemic. I think one of the things that when we think about this, what are we facing when kids return to school? And what did you say? 3 weeks, 4 weeks, starting in August in many parts of the country. Some kids haven't been out and they've been in summer programs all along. I think we're going to see a greater diversity of kids. And it's in terms of learning loss, kids are learning all the time. They may have had a loss of instructional time, and that's true. But then we have to remember, we did a study at the Bezos Foundation where we looked at engagement before the pandemic. I happened to be doing a study for a book that I'm doing. And then we looked at it during the pandemic. Before the pandemic in December of 2019, 56% of older kids were either somewhat or really engaged in learning. During the pandemic, it dropped down to 33%. So, I mean, it wasn't so great to begin with, but it really dropped. So I think we need to start there and understand first that our job, instead of thinking about learning loss, is how to engage children, because children don't learn unless they're engaged. And then we need to understand that there's a huge, that they're learning socially. I think we've all said that, but at all times, good times, bad times, it's the relationship. You know how we used to say it's the economy stupid, it's the relationship stupid that we need to pay attention to. Kids don't learn without relationships. Jack Shonkoff always says there is no development without relationships, and there isn't development without relationships. We need to understand the diversity of children. There've always been diversity. Look at any group of 5-year-olds going to kindergarten. They're small, they're large, they can do all kinds of things. They can't do all kinds of things in any time, and it's going to probably be greater now. So I think the thing that we heard in this documentary that we're making is individualize. And individualize to me does not mean tracking. It means that kids need to learn from each other. It's not just the relationship with the teacher, it's the relationship with each other. Having kids work at different levels and learning and reflecting with each other, I think, is one of the lessons that we need to take from the pandemic. One is the diversity that we're going to always have. The second is the importance of engagement. And the third is to really in engaging children individualize, and because we're always teaching that individual child, even if it's a group in front of us.
Yeah, the diversity of learner. I recall a few years back, we had a few electeds. Governor Brad Little was lieutenant governor then. We went into a kindergarten classroom. He saw 4-year-olds and pre-K classrooms and kindergarten classrooms, same hall. So he saw 4-year-olds that knew their alphabet, knew how to spell their name. We were starting to cite words, and saw kindergarten kids down the hall didn't know their alphabet,
right? Didn't
know colors, certainly didn't know how to spell, didn't know sight words. And to me, I remember seeing that light bulb go off. That was pre-pandemic.
Mm-hmm.
When you talk about the engagement numbers are appalling, not shocking, but sorry to hear that. When you say diversity, how can we think about using some of these federal resources to support our pre-K and our kindergarten teachers to maybe make the classrooms feel smaller, more small group instruction? Is that something we should be thinking about?
Well, with health and safety, they are going to be smaller. And I think that most families are saying that's a good thing. I mean, smaller classrooms is a good thing. We talked to Linda Darling-Hammond from California, who talked about the fact that we should be using tutoring. So if we think of children learning from each other, we think of having some of the federal funds to provide tutoring, but we have a mindset, both an opportunity mindset and then a mindset that children are going to be different. Any group of 5-year-olds has always been different. And now they're maybe going to be a little bit more different because of the experiences that they had through the pandemic. If we could understand that as the basis of teaching and learning and capitalize on the fact that children can learn a lot from each other. We heard about classrooms, for example, where you don't group them by ability in learning to read. You group them across and not just the good readers helping the low readers, but grouping them across different abilities, because there's always something to learn and to teach with each other. And I think that if we can capitalize on all of the people around us and just use them a little differently, we can not only recover from the pandemic, but we could actually make great strides in improving education. 56% of kids is not good enough for me.
Indeed. Governor, I'm keeping an eye on time, so I want to make sure I get to this question around silver linings. What are some practices or experience lessons you've seen that we've learned as a people, as a society, that you'd like to see sort of be part of a post-pandemic world?
No, and I think we've touched on it. I know today, as we go through the conversations, that we keep in mind the importance of early childhood education. That is where a lot of our preventative measures, where the future is going. I have seen that through the pandemic, there was an awareness. There was an awareness because I have to say, in our state, and most states, as I talk to lieutenant governors and governors across the country, they didn't have childcare. And suddenly they recognize how incredibly important early childhood learning is. And as Ellen talked about it, seeing things not as a loss or an adversity, but picturing our opportunities. And we need to be not only investing in the social emotional, but putting those resources in place so that communities of color or communities at greater risk have the correct trained workforce. We in Delaware are putting a lot of funding into early childhood. We want to be putting more into our workforce development. We need good, enthusiastic teachers at all levels because they will empower the student. And I often use the visual when a child comes, as I teach in an academic higher ed setting, picture each child, whether in pre-K or a senior in high school, coming in with an invisible backpack. The silver lining of COVID has been we've become more aware of what that child is bringing in that invisible backpack, whether the trauma from home, the loss of learning, housing disparity, food insecurity. And so for policymakers here today, which I love the bipartisan work that we're doing, we can really make a difference and not have a lost generation. And so again, early childhood investment, creativity, thinking about social emotional learning, reevaluating how you are spending resources, because it's not just enough to throw money at a system, it's how you're dispersing that money too. And I think the silver lining from COVID has made us really aware of that.
Ellen, do you want to weigh in on that question?
I do. How did you doubt that?
She just jumped up and down.
I'm passionate about the research. You can see that. I have a different way of looking. I think the attention that social emotional learning is getting is fabulous. As I said, children learn through their social brain. They learn through relationships, and they learn when they're emotionally engaged. So that is fundamental. But I'd like to step back and have us think about developmental needs. All of us, all people, and children and adults, have the need to belong. We have the need to be supported. We have the need to feel competent. We have the need to have some say or some autonomy over our lives. Those things are true for infants and toddlers and for preschoolers as well as adults. And so I would like to see us, in the spirit of flipping the switch and using the lessons from the pandemic, pay attention to the needs that are social, emotional, and cognitive. If we could help kids feel that they belong and then teach in ways that are socially, emotionally, that would make a difference. The second thing I'd like to say is that we were talking about workforce skills, and I don't just mean the kind of technical skills to be in an industry. I think of them as life skills. But one of the things that the pandemic has made very evident is that kids need life skills or learning skills. Executive function skills are the technical term for them. Skills that bring together our social, emotional, and cognitive capacities to achieve goals. And there are things like being able to pay attention, to reflect, to do critical thinking, to understand the perspectives of other people. I think that if we can begin to embed those, as some programs are beginning to do, into everyday life, not just a special course for kids in high school, we can then very well use the pandemic to improve the teaching and learning of all children and all families.
Right. What advice would you two, Governor, I'm going to start with you. Would you be willing to offer to school leaders, district leaders, your contemporaries or policymakers out there about as we think about starting the new school year in a few weeks?
I think we've touched on a lot. I think the patience, the flexibility, recognizing it's not just about the dollar, but how we are dispersing, recognizing the needs in the classroom and your workforce. But I know working with the Hunt Institute this year, I've been so pleased to look at consolidation of early childhood education in our states. If you have not done that, look at how your services are offered. You need to be making sure it's not hard for families, one-stop shopping, accessibility. And we've been putting in place creative programs that meet each zip code's requirement. Perhaps you need a home visiting nurse. Perhaps you need extra hours after school, whatever it might be, that individualization. I know that's easier said than done, but I'm really excited about the opportunities laying ahead. And thanks to the expertise of someone like Ellen and others in this room, I think we can really work together. And thank you for that opportunity to be here with you. And I hope you catch me later and we can share ideas.
Ellen, advice?
Yes. I have two wishes. One comes from Beth By, who's the commissioner of early childhood in Connecticut, who said, I just would like everyone to understand child development, because I think if we understood child development, we could really teach children in a much better way. But my second one is that I wish that each of us could step back, and each community, each school, each early childhood program, each community service could step back and say, what are the things from the pandemic that we learned that were positive that we could carry forward? I know families had more time together, for example. The priorities of the importance of family became much clearer to people. I would hope that there's a systematic process in each organization and each community to take that moment to reflect and use the lessons of the pandemic to create a better future for all of us.
Governor, as a closing thought, do you have a hope? What is your greatest hope from this, the takeaway from this pandemic for the future of our country?
I think the greatest opportunity is us coming together in a unified way to really address social determinants. I'm being biased because I'm a public health provider, but as indicated here, it is about really the social emotional component and recognizing the larger community. And as policymakers, I think all of us in here have been committed to that. So, and then I have to do, since we are early learning, I have to give the plug. Please, as policymakers, keep at the forefront the real critical need of our earliest learners, particularly as it relates to brain health. Just had to get that in.
I will echo that.
I saw the mic come up.
Well, I thought you were going to turn to me. Yes, the importance of the early years. That's the foundation upon which all of this is built.
And I see our friend, I saw Rachel Schumacher here earlier, and Ellen. As my background was K-12. When I first met you and folks like Rachel, and obviously Dan Worry's name has come up, the past few years, pre-pandemic and certainly through the pandemic, it's only been reaffirmed that our country has to do better for prenatal to 3. That's where the biggest bang for the buck is, because we were spending too much time, we being the K-12 people. I'm a middle school principal, recovering principal. We spent too much time trying to close gaps that we didn't spend enough time trying to root cause analysis, sort of running analysis on where those gaps are coming from. So I want to thank you for your great leadership, Ellen Galinsky, and thank you for being on this panel from the Bezos Family Foundation, and our dear friend, Delaware Lieutenant Governor Bethany Hall Long. Please join me in a nice round of applause for both of you.